first off, I want to say thank you to Dr. Lyons for his kind comments. I'll pay him later. His check is in the mail. Okay, so thank you so much to Misty Leyva as well for this invitation to be here. Thank you so much. I have to thank Blue Cross Blue Shield, the foundation, Diabetes Free SC, and then my beautiful division of endocrinology. So thank you, Dr. Cornier, my division director, and all of the amazing faculty and staff with whom I'm privileged to work with every single day. So I'm a pretty interactive person, so this is different for me because it's making me stand still. So I'm gonna give you a little bit of a heads up in advance. I want some audience participation, okay? So the first thing that we will start with is everybody take a look at the folks that are sitting at your table. So take a good look at these good-looking people. Yes. So you see everybody you're sitting with, right? Okay, this is your community. Raise your hand if you acknowledged at least one person in your new tribe. Raise your hand if you've said hello to at least one person. Your tribe is your table now. That's your community. Okay, very good. There is not a hand in this room that didn't go up. Now, on a more serious note, when's the last time you said hi to someone in your community that's not your neighbor? The neighbor doesn't count. You take the trash out at the same time or go to the mailboxes that doesn't count. I mean someone that you've never met before, just as you did today, right? You don't know the people that you're sitting next to, but you knew enough to want to get to know your community. There is power in community engagement. And I think we have to move away from the thought process that your community is built with people that look like you. That's not your community. Sure, that is a community, right? And it may be a part of your community, but your community is oftentimes made up of folks who come from different places, different spaces. They have different life experiences, and they have different beliefs. But there's power in community engagement. There's power in the fact that everyone in this room thought enough to say hello to the person sitting next to them. All right? So no relevant disclosures. I wish I had some relevant disclosures, but there are none to comment on, okay? Let's talk about objectives. So the teacher in me won't let me do a presentation without letting you know what's getting ready to happen. So the first thing we're going to do is define the relationship between health equity and community engagement. Then we will discuss the role Diabetes Free South Carolina is playing in creating these very effective community partnerships and thus reducing gaps in health disparities. Then we'll discuss some guiding principles for engagement. And then last, we will end by talking about the impact of engagement in 3 different domains. So the institutional impact, the individual impact, individual being all of us, the folks that are engaged in this work, and then very important, the impact this has on our community. So I want you to look at this. This quote comes from one of my all-time favorite authors, certainly an inspiration in the realm of public health. He's an endocrine surgeon, so as an endocrinologist, I'm obviously obsessed with that space. But better is possible. Better is possible. It does not take genius. It takes diligence. It takes moral clarity, it takes ingenuity, and above all, it takes willingness to try. See, my grandmother, and I had a couple of grandmothers I was blessed to know. I think about one specific grandmother who's had a very significant impact on my life and my life trajectory. She was on a farm in Southeast Georgia. My earliest memory of my Granny Ruby, I was about 5 years old, and I remember walking into her shotgun house and going in to sit on her lap, and you could smell the aroma of all the things I tell my patients now not to eat. Okay, but that house smelled so good. And the thing that she told me is, it doesn't matter how smart you are, people won't remember you for that. They will remember how kind you are. And don't ever let anyone tell you things can't get better. So when I started reading Atul Gawande's publications and his books, I was immediately drawn to that body of work because it was quite reminiscent of the same values that I'd grown up with. Each one of us in this room does something a little bit different, right? Even within the community of social workers, community health workers, dentists, architects, educators, scientists, data analyses, we all do something a little bit different. Our day-to-day is unique, but we all have one common thread. We all took a commitment to work for our communities because we believe better is possible, right? If we stop believing better is possible, we lose the fight. Our communities depend on us believing that better is possible. Now, this is a picture that I took in an airport, and I love this because it sums up equity, right? So what you see here are a bunch of water fountains, but they're water fountains that are not all at one level. See, if I designed a water fountain, I would probably design it so that it was suitable for somebody 5'4.5" without heels. You know, it'd have all the right dimensions for someone 5'4", but what they did here is they've made sure they don't care if you're 6'3" or 4'11", you have access to the same thing, water. So what is equity? Equity and equality are not the same. And I want to start off by saying that. Equality would mean that each one of these water fountains would be built at the same level, the same way, same size, to accommodate one purpose. And if you're too tall, you'd have to bend down. And if you're too short, you may have to step up. Equality is different, though. Equality is taking away unfair or unavoidable life circumstances that don't level the playing field. It's making sure that regardless of how big you are or small you are, how rich you are or poor you are, how educated you are, or maybe you lack that formal education and you harvest that wisdom in other ways, you still have the same opportunities. And in health, that translates into reducing gaps in health outcomes. So health equity is beautifully stated by the World Health Organization as the concept that everyone should be able to obtain the highest level of health possible and should not be disadvantaged because of socially determined circumstances. I'll pause there for a second. The teacher in me has to ask, are we all good? All right, all passengers, all aboard, we're good. Does the train need to stop or can we keep moving? We can keep moving. All right, very good. So everyone, just about everyone now at least has heard about the social determinants of health, even if you don't completely understand the concept. This has gotten a lot of press lately, and for good reasons, right? So let's talk about what health equity and what the social determinants are. But before we get into the weeds, understand that health status and health equity are influenced by the social determinants of health. So what are they, right? So if you look at this person, what you'll see is that only 20% of what we do in healthcare, doctors, nurses, right, physician assistants, nurse practitioners, the lists go on, medical technologists, only 20% of what we do in healthcare has an actual translatable impact on health outcomes. That's sobering, right? For those of us that see patients every day, and many of us don't, but we understand the work of medicine, I think we oftentimes overestimate the impact that the work that we can do will have on translatable health outcomes. If only 20% of what I'm doing in the office as an endocrinologist is having a translatable impact on the health outcome, that means 80% is something else or some things else. And if we look at the remaining 80%, we've got everything from health behaviors to physical environment, and socioeconomic factors have the greatest impact on health outcomes. What are these socioeconomic factors? Well, these are the things that impact our health that are more so related to where we live, where we work, where we pray, where we play, the environment in our neighborhoods, pollution or clean air. All of these things have a tremendous impact on our abilities to lead good, healthy lives. And that translates into years, life, right? So if we keep moving, I love this pyramid. There are a lot of pyramids that will pop up today, but I want to give a special shout out to this one. This pyramid I first saw as a college student. And this pyramid at the time piqued my interest in things about health that were not just related to prescribing medications or making sure, the dose of the blood pressure medicine that you're taking is the effective dose for you. I didn't know at the time that I was looking at a pyramid that would essentially emphasize the importance of focusing on the base, those social determinants of health, and how if that's not right, you never get to the pinnacle. So if you look at the bottom of the pyramid, you'll see Maslow believed that your basic needs have to be met before you can achieve self-actualization. So let's break that down. If our basic needs are not met, security needs, okay? Physiological needs like food, shelter, warmth, rest. If those needs are not met, guys, we don't get to address the esteem needs, right? Those belongingness needs. And we certainly don't get to the top of the pyramid, which is self-actualization. Now, I want you to use your imagination. In my house right now, I've got two very imaginative little boys. I've got a 2-year-old who flew off a couch at my mother's house last night. Okay, that was a near miss. Okay, and then I've got a 7-year-old who uses his imagination every single day. So I want you to use your imagination. Close your eyes for me, if you don't mind. You are a 16-year-old young woman who lives in a neighborhood where most of the folks in that neighborhood are right at or below the poverty line. You have dreams of becoming a nurse. You've never met a nurse before, but you know that you want to give back to your community in that very specific way. But here's the problem. You struggle with food insecurity. You struggle with housing insecurity. And most days you go to school, you can't even stay awake enough to focus because you're tired, because you were helping to work to support your family's needs. You've got a couple of siblings and you've got a real hardworking mama. Now open your eyes. I know stories like that, where that young girl has risen up and has been able to self-actualize. But it was not without the help of her community. When we look at our communities and we look at those who don't have access to those basic needs, there is a high probability that without our platforms, with our help, they may not reach that self-actualization mark on this pyramid. Now, I don't want anyone leaving thinking that people from those circumstances don't make it, because I'm a living witness that they do. But I will tell you, it requires community support. Okay? So as we move along through the presentation, I want you to think about your own communities. Think about the opportunities in your communities and the power of engagement. Now, the CDC has a beautiful health pyramid that I refer to a lot when I'm teaching my students. This is the health impact pyramid. And what you'll notice is the largest impact on health is, again, right at the bottom. It's the base of the pyramid, right? It's holding everything up. But what does it reach? Socioeconomic factors. So we're going back to that thing again, right? And then the very top of the pyramid is what we take such great pride in, and it's still very important. But understand that we have to make sure we're addressing the issues that have the largest impact on translatable health outcomes if we are to then hope to have a significant impact as we counsel patients and educate our communities. So now it's time to celebrate. So I've made everybody sad, all right? Now I'm going to lift you back up again, okay? So it's time to celebrate. This is my favorite part of the presentation because I'm celebrating you, okay? I have had the pleasure of being blessed to learn about all of the amazing efforts that are taking place. And these aren't just efforts. These are real initiatives that are driving about change. So feel free to cheer when your initiative is called. And if it's not called, you pull me aside and we'll make sure we include it. But I want to talk about how Diabetes Free SC is living up to its commitment to engage our community. But first, you got to understand, what is community engagement, right? It's a nice term there, but what does it really mean? Community engagement is the process of developing relationships. I love that word, relationships. We're developing relationships that enable stakeholders to work together to address health-related issues and promote well-being to achieve positive health impact and outcomes. Let's break that down. There are undeniable benefits to engaging communities in promoting health and wellness. And at its core, community engagement is essentially about developing patterns, practices, policies that change behaviors in communities so that we have better outcomes economically, so that we have better health outcomes and better education outcomes. So there is this intersection or interconnection between health equity and community engagement. And I won't read through every little thing that's bulleted there, but understand that one supports the other. So good, effective community engagement supports health equity efforts through empowerment, number one, right? We are empowering the individuals in our community to take charge. We are inviting them to partner with us, not so that we can take charge in those communities, because we should not be the face. We should be there to support, right? We should be there so that we offer resources, facilities, technology that may otherwise be unavailable for some of these communities to use so that they can implement effective programming. Trust building is important. We go back to that word relationships, because we have to understand that when we're walking into communities, we are outsiders in some instances, okay? And that's okay. But you don't gain trust just because you're present. Trust is something that develops over time. Okay? How many people would trust someone they've never met before with their life? Very few of us. But guess what? When someone walks into my doctor's office, they're trusting me with a part of their life. So it's very humbling to have a platform where folks are trusting you, but we can't take that for granted. And we can't underestimate then the importance of building relationships to consolidate that trust. Okay? Enhanced understanding of needs. Community engagement absolutely sheds better light on what the community's needs are for the institution it's partnering with, and certainly for those who are involved in the work. Tailored interventions. I love tailored, right? So tailored means that it's not a one-size-fits-all solution. It's we'll do it this way for this community because they have those needs, and maybe we tweak something about how we've done it for that community because this community has some other needs that have gone unaddressed. The same sentiment. We want to reduce gaps in health disparities, right? But we're making sure our approach is tailored to meet the needs of whom we're serving. And then increased access to resources. So, some features of successful engagement, and this is where you all get your shout outs. So the first feature is mutual benefit. So a fundamental aspect of any successful collaboration in life, not even just, community engagement. I think about being a mom is mutual benefit. I'm learning very quickly with children that, you have an idea of how things need to go, but sometimes you got to highlight the mutual benefit in order. Okay? Sometimes we have to highlight the mutual benefits so that we get little people to move, right? So that's how that works in our house. But how does that work on a larger scale? If I'm going into a community, that community is a lot smarter than I am about their needs. It doesn't matter how many degrees I have or how many hours I've spent training, okay? That community is smarter about its needs, smarter than I will ever be. So there's humility that goes into that process. That community is also a lot bigger than I am. I'm one person walking into a community. So I have to establish a relationship that's built on trust, but the first thing I want to highlight are the mutual benefits. So how has Diabetes-Free South Carolina done this? Well, it's done this in a number of ways, but I want to highlight 2 programs, okay? The first program that I'd like to highlight is the South Carolina Surgical Quality Collaborative. Okay, this I think is brilliant because it's essentially a program that is looking to improve, and it is improving, general surgical outcomes. But like how, right? How are we going to improve general surgery outcomes? What does that mean? Well, it means a lot of things. Prevention of wound infections, more rapid recovery, better pain control, and a lower risk of bounce backs, lower risk of returning to the hospital. Who benefits? There's a mutual benefit. The patients obviously benefit, right? Better pain control, right? Effective wound healing. I don't have to go back to the hospital. But the health systems benefit. Because when patients have poor outcomes, it does not just affect the patient. It affects the health system, and there's a cost to that. The second program that I want to highlight is the MOMS program. I'm obsessed with the MOMS program. This program has done such amazing things in a very short period of time. If we look at MOMS, the conception, no pun intended, was around the summer of 2020. Since that time, a little over 2,300 deliveries have been associated with MOMS care. All right. There are 3 sites for the MOMS program. We have 2 Prisma Health sites, the upstate. We've got one right here in the Midlands, and then there is a site in Charleston. Implementation of MOMS has done a lot of things, and I'll highlight these things. Fewer C-sections, fewer neonatal intensive care unit admissions, preterm birth rates down, reduced episodes of neonatal hypoglycemia. And guys, that's a big deal. You can have significant neurodevelopmental sequelae if we have significant enough neonatal hypoglycemia. So that's a big deal. Reduction in small for gestational age babies. And then improved APGAR scores. These are the scores that we give babies within the first minutes of life to assess their viability. And APGAR scoring has been linked to all sorts of things in terms of health trajectory later in life. So APGAR scores are important. We don't want to brush over that. What is MOMS really doing though, right? So all of these things sound great. But the thing that I'm most fascinated about is the MOMS program is essentially improving longitudinal health outcomes, not just for mama, but for her baby or babies. Okay, how a baby is brought into the world, the condition of a baby when she arrives in the world, or he arrives in the world, has a lot to do with what life looks like 30 years down the road. The condition that we create for babies when they are in utero, when they're inside of mama, growing and developing, the condition in that hotel, we want it to be a 5-star hotel. I tell my patients, 5 stars for the babies, okay? We don't want a 1-star hotel for the baby. We want a 5-star hotel. That condition has a lot to do with health outcomes 30, 40 years down the road. Those babies can't control that environment. They can't manipulate that environment. So it is up to us to make sure that we are taking care of women when they are pregnant, that we are taking the best care of women when they are pregnant and have chronic diseases like diabetes. And then lastly, for those of you like me, I like numbers. Well, here's some numbers for you, and these are impressive. There are immediate and long-term economic benefits when we do the right things for moms who are pregnant, specifically those with diabetes. The cost savings for cesarean sections under this initiative is just under $2 million. And the cost savings for NICU admissions, just under $30 million per year. That's impressive. Okay, so big old shout out to moms. They deserve it. I agree. Yep. Now, clear communication. All right, well, you know, communication is fundamental. It's just like establishing good relationships. You have to establish good, clear communication, as Dr. Lyons said. Don't assume someone understands what you mean or even received your email. Sometimes you gotta pick up the old phone, right? Sometimes you just gotta pop up nicely now. But sometimes you have to put your space or self, in a more old-fashioned mindset, as my grandmother used to say. Enough of the texting, and you're talking to someone I text about every minute of the day, so I'm not knocking it. But what I am saying is that when I send that text message, do I know what that person's face looks like on the receiving end? They may have snarled when I sent it, right? Even if they hearted it or thumbs up the message. You don't know how people are receiving the messages you're delivering unless you've established a clear foundation for communication. Okay, so what does this look like? If Diabetes Free SC is collaborating with a community partner, you can expect that there will be regular stakeholder meetings, right? There will be regular meetings between Diabetes Free SC and academic, clinical, and community partners. Why? So that we can talk about progress, so that we can talk about gaps and areas that need to be better consolidated. All of that is important to make sure real goals are being met and real change will ultimately occur. Shared goals and visions. I like this one too because of the word sharing. Big word in my house right now. Sharing. Convincing a 7.5-year-old who doesn't let me forget to say the half on the 7.5, to share with a 2-year-old, and he's about a week and a half into being 2. Sharing's a hard concept, especially when there's that gap there. But think about the gaps that we have when we walk into these communities. All right, we are blessed and privileged to have received degrees in education in ways that many folks in our communities have not. There's a gap there. Despite that health literacy gap, despite that education gap, despite that wealth gap in many instances, we've got to share the vision. It can't be that I come into your community and tell you how I think things ought to be done because I read a couple of articles that told me the data show you may not be invited back, right? We have to make sure we're understanding what the vision for the community is from the people in the community. And then how does that align with what the data are showing, right? So what's that look like with Diabetes Free SC? I love this one. Diabetes Free South Carolina sponsors an initiative to tackle food insecurity in the community by partnering with Food Share. Share is even in the word. I love it even more. By bringing together community members and local organizations, all, emphasis on all, y'all, all parties can contribute to a common goal. And if we're to talk real numbers, with DFSC support, Food Share South Carolina has been able to expand from 7 to 22 hubs, and to date, almost 65,000, this number is higher now, fresh produce boxes have been distributed to South Carolinians. That's amazing, okay? So, if you're coming to see an endocrinologist or a primary care physician and they say, hey, I need for you to eat better so that we can lower this A1C, Maybe the nurse practitioner, physician assistant, or pharmacist that you see for your diabetes management says, hey, buddy, we have got to start making healthier food choices so that that A1C can come down. What's that mean if you don't have access to fresh foods? Right? What's that mean if there are socioeconomic factors like food insecurity, I want to highlight, that have not been properly attended to? It means you told me what I need to do, but you've not helped me do it. But Diabetes Free SC understands that we can't just be good orators in spaces where we touch the community. We've got to be effective statisticians. We've got to be good workers, good listeners, so that we truly understand how to bring these things to life. Incorporating diverse perspectives. So what's this mean? Understand that diversity isn't always talking about folks that, look different. Diversity is a little bit different than that. It's much more broad, and it's actually a lot deeper. Diversity is making sure we are bringing folks into the fold that come from different places and spaces and have different life experiences. I want to pause for a second. If I choose one ethnic group, understand there's significant diversity within every single ethnicity, every single race, okay? None of the ethnicities are monolithic. So diversity is all about making sure we are inviting people into the space where we design these projects that are going to bring something different to the table. Diversity doesn't mean that we agree, okay? In fact, when you are creating your teams, I would challenge you to pick some folks who don't agree with you all the time. That's important. And the reason it's important is because you want to make sure you're seeing all the different perspectives that could be represented during the course of working your project. So what's this look like with Diabetes Free South Carolina? Well, DFSC sponsored efforts engage a diverse population of folks. You're talking clinicians, social workers, community health workers, scientists, the list goes on and on. And if we want to look specifically, there's a lot of heterogeneity, right? So a lot different about education levels, occupations, okay, life experiences, backgrounds, positionality. All of that's very diverse when we look at the teams that we create to get initiatives done. Diabetes Free South Carolina has partnered with the Center for Community Health Alignment to support curriculum development so that we are doing a better job at integrating community health workers, okay, into diabetes prevention platforms at FQHCs. These are federally qualified healthcare centers. Why is that important? It's important because I think about my own family. I mean, they listen to doctors a little bit more now because of me, but I have to keep it real. The things that mean most to the people in my own family come from folks that are in their communities. They don't have to have an MD or DO or an NP or PA behind their names or RN. These are folks that have been educated to better understand the problems, the chronic ailments, diabetes in this case, that are largely impacting longevity and success in our communities, but they can relate to you on a level that makes you feel comfortable. It makes you feel comfortable sharing, and it makes you feel comfortable dreaming. It makes you more likely to achieve. So I want to give a special shout out to community health workers. The work that you do, no value can be placed on that. And I think that we should take a moment to acknowledge the sacrifices you're making for communities, okay? Sustainability and longevity. Let's just sum this up. It's beginning with the end in mind. So, how you start is how you finish. So making sure when we design these initiatives, we're not just thinking about all of the excitement that will come at the forefront of getting our feet on the ground. We're making sure we understand what's our goal for the end? What's the end look like? What do we envision, dream, right? What do we want the end to look like? And then how do we design this project so that we are making sure there's some sustainability and longevity there? So another shout out to moms, but now I want to highlight the Women's Health Initiative because this is really a summation of that sustainability and longevity. So the MOMS program is focusing on improving the health outcomes of pregnant women during the pregnancy and in that immediate postpartum period. But then there's WHI. WHI says, well, wait a minute, when these women are no longer pregnant, what do? Well, we take care of them because technically a large percentage of them who are childbearing will go on to have additional children. So that postpartum care in WHI becomes preconception care, right? And then this is the beautiful thing about life. It's all a cycle. And then we cycle back again into another pregnancy. But this time, unlike our first pregnancy, where moms had to get that 10A1C down to a 5.8 or 6, right? Okay, unlike the first time, we come into the second pregnancy with a 6.8 A1C because we have been working with the Women's Health Initiative. We already are setting mom and baby up for much better success for years to come. So beginning with the end in mind, and then let us not forget diabetes prevention, and a shout out to all the Women's Health Initiative programs that are focusing on diabetes prevention. Let's prevent the thing, right? Before it even gets started. So sustainability and longevity, a big kudos to those who are working with WHI. Now, this one is interesting, but for me, conceptually, it was one of the hardest principles to understand, okay? Evaluation and adaptation. I could wrap my mind around the evaluation part, but the adaptation is a little bit tricky. And I'm going to give you a couple of examples of what that may look like. So effective collaborations incorporate mechanisms for assessment, all right? So it's good to dream, and we all do, but what is our dream or what's our vision if we don't ever pause to say, are we being effective at what we set out to do? Where's the accountability there, right? How are we making sure we're really moving the needle? Are we just sounding nice, or are we really doing nice things for the communities that we're serving? So just like a scientist will adjust his or her experiment based on findings, community partnerships have to be flexible in their willingness to adjust. All right? So what's this look like? Well, if a community health initiative is not achieving its desired outcomes, ongoing evaluation can help identify barriers, and we can adjust accordingly. Adaptation, this is the trickier one. Now, what does this look like? Diabetes Free South Carolina recognized the need to expand touch points for diabetes prevention. What do I mean by that? We essentially have a condition that, if not treated and not prevented, will result in significant morbidity and mortality. So how do we expand the number of folks, the number of lives, real lives that we reach in a meaningful way, so that for years to come, when the next generation of folks are sitting in this room, they can celebrate the success of these efforts? Children, right? Kids. So you think about the touch points for DFSC: women, adults, children. Children are so special, though, because very small things that we do can have humongous impacts later on in their lives. So how do we do this in a coordinated way? Well, Diabetes Free SC decided to support programs that would essentially expand the ability for children to get active and engaged in their communities in a safe way. Kids in parks. I love this because my oldest son has an obsession with all things plants. And people from MUSC that are here, you guys know this. Andrew is a self-proclaimed horticulturist. He can't say the word yet. but he knows that somewhere in his future he's working at a nursery or he's helping to design things. If parks were not present for children, I don't know what our life would look like, really. That's a source of comfort. It's a release for kids. It's a way to promote active engagement. Guys, it's a way to foster inquiry, imagination, social, emotional development. So this particular project I loved, and I wanted to put it in because I thought it was an effective way of showing how we can evaluate where we are. We're doing all these nice things in the state, but our outcomes, we still got work to do. Where do we go next? We adapt, and we start to look at a different population of folks where even small changes can have humongous outcomes later in life. This also may look like this. Diabetes-Free South Carolina recognizing the need to expand touch points for diabetes screening. So we've moved from diabetes prevention with kids in parks to diabetes screening. And this is a very unique partnership with Affinity Health Center, where diabetes screenings are now occurring in the dental clinic. So what's that all about, right? So I might miss my primary care appointment, but I'm not missing that appointment for my dentures. Okay, I might miss that primary care appointment, but I've got to go get this tooth looked at because it's nagging me, it's hurting. There is a lot of foot traffic in our dental clinics, and this partnership is essentially recognizing we have them here. We have our patients in our community right here, right now. Why are we then telling them that their periodontal disease should be further evaluated by going to see another provider who will then run an A1C? If I'm the patient, I'm hearing cha-ching, 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 time that I don't have, and this is expensive. So let's bring the prevention to the space of trust. Let's bring it to where the patient is. So kudos to this initiative because it's highlighting the importance of us having a more proactive approach about disease prevention and community engagement versus the historical reactive approach. We have the disease now, let's deal with it, right? So each program highlighted there really emphasized some of the solutions and key principles for community engagement, and it wasn't very hard to pull programs that Diabetes-Free South Carolina has already established. So kudos to everyone, again, in the room for all the important work that you do. Now, I'll bring us down just a little bit, but it's not to bring you too far down. I just want to be honest that there are some challenges, okay? Community engagement is nice and it's great, and when it goes well, it's full of rainbows. But guys, there's a realness about engagement in that there are inherent challenges built into doing this work. And I want to talk about some of those challenges. Mistrust is the first one. So we are going into communities where we don't oftentimes have the same shared life experiences as the populations we're serving. That should never deter you from doing the work. Okay? Just because you don't look like or have the same shared life experiences as the folks that you're trying to serve, don't for 1 minute ever let that make you think you can't be effective. It just means you got to call the elephant out that's in the room. And the big elephant is, I might not trust you because I don't know who you are yet. There's historical precedent for mistrust, particularly with research and medical interventions. And I won't get into that today, but understand that sometimes that pushback that you feel, that resistance that you feel when you're first starting to engage a community, particularly if that community is not a community that you are from or can relate directly to, don't let that deter you. Let that inspire you to ask questions, to humble yourself, and get to know more about what may be the foundation of that mistrust. Lack of representation. Lack of representation, the best way that I want you to think about that is before community health workers, okay, we essentially relied on folks in doctors' offices to do the work of helping prevent and treat diabetes. Community health workers are folks that are in the community, right? They are representing the realness of the community that exists and that is necessary to evoke real change in chronic disease outcomes. So without representation from our community health workers, I'll pick on them again because I think they're amazing, then I think we are missing an opportunity to fully represent the population that we are aiming to treat. Limited resources. It's a real thing. How many times have you wanted to buy something, but maybe at that time you didn't have money for it? You're limited in your financial resource. That's a personal adage there. But think about what that means on a larger scale. We can conceive ideas, we dream ideas, but sometimes we don't have the funding and to support to make that happen. So when we do have the opportunity to partner with a group, Diabetes Free SC, that is helping to provide that support, that's a tremendous leg up on getting the job done. Taxation and burnout. I'm going to lump those two together. Okay, raise your hand if you've ever experienced burnout, ever in your life. Very good. Maybe I should have said raise your hand if you've not been burnt out, because then I want to know, like, what are you doing? This is great. Tell me the secret. The truth is that if you love something enough, if you're passionate enough about something or somebody, you're going to burn out. Burnout is the manifestation of us giving, but not having that cup refilled. You ever been to a restaurant and you're like, oh, they'll refill me soon. And you're sitting there and your cup is on empty and it's been on empty for a while. How do you feel? You feel parched, you feel stuffed, you feel miserable, you want to walk out and leave, right? You need someone to fill your cup. You need things to fill your cup. And I want to convince you over the next couple of slides that community engagement, volunteering, reaching out and touching, getting to know the people in your community is one effective way. And there are data to back it up for those that are like me and you're data driven. There are data to show that there's ways to fill your cup through community engagement. But burnout is something that happens, and I don't even know if we should be trying to avoid it, because I think it will happen. I think we should develop mechanisms for how we deal with it when it's occurring. How are we checking on our strong brothers and sisters? They say check on your strong friends. And what that means is the person that always has it held together, you check on that person, because that person it's usually carrying a lot, right? So burnout, not being afraid of it, because it will happen when you love hard enough, right? But then what do we do when we're there? And how do we get our cups filled again? The temptation to overpromise. I will promise you that I will eradicate all diabetes from the earth, right? Wish we could do that, right? Be careful with overpromising. When we go into communities, we are entering a space where we are walking in on a certain platform of privilege. And it is bad to promise something that you can't make good on, because then that circles back around to that first bullet, which is mistrust. Okay? The goals of the project may overstretch the team. What you want to do, what you conceive in your mind's eye may be fabulous. Okay? But maybe you just don't have the personnel to get it done. It doesn't mean you shouldn't still dream big. It means you should dream in phases, right? So phase 1, we start small. Phase 2, we get a little bit bigger. And phase 3, we've got some grant funding now because we've got data and outcomes that show that we're doing good things. And now we're able to go full forge ahead. So solutions and guiding principles, and I'm going to go over this rather quickly, but I want to focus on a couple of key things. Authentic is the word that I want to pull out there. So there's some guiding principles that Diabetes Free South Carolina has developed. And the guiding principles essentially focus on innovation, implementation, alignment. I love that word alignment, right? The reduction in health disparities, focusing on prevention of chronic disease, in this case diabetes, focusing on early life intervention, rigorous data collection, and then plans for sustainability. The thing that I think so cool is one of the papers that I love the most that talks about authentic engagement. Every single guiding principle from DFSC, you can pull it out of this. So I think we're on the right track. But what's this look like? For folks like me that just like to break it down and make it simple, we need a picture. This is your graphic, okay? Alignment, balance of power, and collaboration have to all balance one another. Okay, you can't have effective, authentic engagement if you are not well balanced. And knowing what community means, you gotta understand who the community is. Don't go into the community with your own assumptions about who they are. You let the community tell you who they are so that you can be best at serving their needs. And then identifying the appropriate stakeholders. I told you guys I was going to go through this part rather swiftly. It's important to bring the appropriate people to the table. And the appropriate people don't always have the same degree that you have. The appropriate people actually probably look very different than you do in terms of their positionality, their life experiences, and their education level. And this is just summarizing that triangular slide, right? We have to make sure power is shared, that we're being collaborative and ensuing the feedback from community members, and we have to also make sure we're flexible. And we must have courage. Courage, right? I think about the Wizard of Oz. This is a hard word because courage is sometimes scary. Courage means that we can't be afraid, and I'm not going to go through every single one of these bullets, guys, but courage means that we can't be afraid to identify the problem, call the problem out, and utilize our platforms to help develop mechanisms for real change. But what happens when you combine courage with authenticity? You get courageous authenticity. And this is a leadership concept that's been well studied. And it is hard to lead and be courageously authentic, but I think everybody in this room is capable of doing it. It's something that I continue to try to work on every day. It's hard. Courageous authenticity translates into building better partnerships, ensuring inclusive practices, sustaining engagement efforts, and transforming obstacles into opportunities. We are our best when we are courageously authentic. I want to leave you with this, the impact of community engagement in multiple domains, and I will run through this quickly as well so that I don't lose you. So the impact of engagement at the community level, several different benefits. Access to resources. The community now has access to better facilities, more technology, and your expertise because of your partnership. Addressing local issues, environmental concerns, health disparities, gaps in education and health literacy. Capacity and skill building, increased civic participation. I love this one because data are consistent in showing that when we engage the members of communities, these are the same folks that then go on and spread the word about the goodness, and then they get involved in decision-making processes that affect policies, practices, education, and economic outcomes in those same communities, and then improved quality of life. Mutual benefits we've talked about a lot. Social capital, we can talk about that one at another time if we want. That's a whole different presentation, but it's important for institutions to understand that we've got to build the trust or gain the trust of those in our communities by increasing our social capital. And then research relevance. Groups that are community engaged have higher likelihoods of receiving government funding. They've got higher likelihoods of receiving funding from private sector and from stakeholders in their local communities. How does the institution benefit? Well, institutional change and development. We can start to develop and design policies now that are in alignment with what the community's needs actually are, instead of us relying on data that are showing we should be doing this for that community. Now we're doing what the community is telling us they need for us to do. Funding and support, and then long-term relationships. Now, for the individual, for most folks, community engagement is a positive experience. But I'm going to skip down to the bottom because I would be remiss if I didn't comment on the fact that community engagement is not always universally positive. Community engagement can be jarring for some folks. You might be taking someone back into a situation that really reminds them of where they've come from. It can be traumatizing, as you just mentioned. PTSD is a real thing. So please, let's be sensitive when we're working with our groups, when we're working with those members on our teams. We must have a certain level of emotional intelligence that allows us to recognize when someone's not comfortable in a certain space, okay? Mental health benefits are there. Reduction in stress and anxiety amongst those who are engaged in their communities, social connections, physical health improvements, and then increased life satisfaction. Cognitive benefits. There are some data that show middle-aged and upper middle-aged, I don't like the word elderly, but middle-aged and upper middle-aged individuals have cognitive increases as a result of regular engagement in the community. Enhanced resilience, the development of skills, and then lastly, community well-being. Community well-being, we are dedicating our lives, our purpose to making sure there are better health outcomes for the communities that we serve. As those communities benefit, data are consistent in showing that that makes us want to give more. But understand, we can't be impatient about success. Success takes time. You may not go into a community and things are better overnight. It probably will never be that way if the problem's big enough. And guys, we're tackling big problems. So sometimes success is something real small. But success is counted sweetest by those who near succeed, for Emily Dickinson fans, okay? We have to stop looking at success as we have obliterated it from the planet in a year. Success is what Moms has done. Success is what your Search for Quality Initiative project has done. Success is what our community health workers, dental clinics, Kids in Park sponsors are doing. That's success. And now I'll leave you with this. Community engagement is essential for achieving health equity. We can't achieve health equity without the work that you do. So now here's your call to action. Use your platforms, use your privilege. Everyone in this room has privilege of a certain variety. Use everything that you've got for every day that you are living and breathing to give back to your community, because you will make many people proud whose names are never spoken, but we stand upon their shoulders every single day. Thank you all so much for your attention.